Appearance, demeanor, respect, and professional boundaries in nursing. Professionalism in nursing incorporates principles critical to advancing the quality of patient care while observing moral, cultural, ethical, and legal values outlined in nursing practice guidelines. According to Go, it offers excellent health services while implementing respect, advocacy, responsibility, honesty, and accountability, among other standards. It, moreover, extends to a practitioner's capability to communicate effectively and self-examine conduct and actions, continuously striving for both professional and personal growth. This work reflects what I have learned and my ability to demonstrate expertise in terms of appearance, demeanor, respect for self and others, and attention to professional boundaries with patients, families, and caregivers. Attention to appearance. People judge others based on their first impression of the person. This is critical for nurses because it determines how patients feel and view the staff giving them treatment. Clients and their families may lose confidence in a service provider because of an appearance. The ability to care for oneself is equated with the ability to care for others, hence the essentiality for clinicians to look good. The above discussed is why nurses should be in uniform. This way, no one will have an excuse not to dress well. Many hospital administrators have resulted in dressing their staff. However, it remains a worker's responsibility to be clean and hygienic. Through this course, I have learned that it is my professional responsibility to look good. I intend to be in clean clothes, keep my nails short, preserve my hair, and observe high oral and dental hygiene throughout. Personal cleanliness will guarantee that my patients are comfortable around me, and they do not view me as an irresponsible person who cannot take care of herself. I will also avoid highly scented cologne. My work entails handling diverse clientele, hence many might have allergies to perfumes. This course has taught me that before I leave my house to work, I should love the person I see in the mirror. It is legal, ethical, and moral to look good in the workplace. Demeanor. Demeanor is the way nurses present themselves in the process of caring for patients. It incorporates attitudes, moods, and behaviors exhibited while interacting with clients. Working with the sick necessitates one to be friendly, respectful, confident, caring, and warm. A good demeanor is vital in nursing because patients are not always in a good mood and require medics to be in temperaments that encourage and give them hope to get through their pain. Through this course, I have learned the importance of putting on a good face for my clients, even with issues that might hinder me from doing so. I developed a culture of dealing with things that can influence my tempers at work. I know that my patients require me to be lively and warm to motivate them to look forward to healing, especially the inpatients. Creating a good rapport with my clients and maintaining a therapeutic relationship will always be my priority in this profession. Respect for self, colleagues, and patients. Nurses have a moral and ethical obligation to carry themselves with respect. Go argues that self-respect is required to preserve the completeness of one's character, individual integrity, and personal and professional identities. Practitioners' esteem attracts others to honor and model their actions. Secondly, working with colleagues requires physicians to value others' opinions and stick to professional boundaries that guide workmate connection. The latter will ensure that staff avoid colliding with others over work issues. Medics, most importantly, have a moral, ethical, and legal mandate to respect their customers. People who come to the hospital deserve to be treated without discrimination on age, sexual category, race, religion, socioeconomic, sexual orientation, and disability, among others. This course has taught me that conducting myself with respect will make people around me treat me with the dignity I deserve. Secondly, working peacefully with workmates will make my work easier. I will honor others' opinions and only provide feedback in ways that will not hurt my colleagues' egos. Lastly, I will always maintain my patients' dignity because respecting them is my duty and moral doctrine. I will consider my clients' culture, religious inclination, preferences, values, and principles to ensure I do not disrespect them in any way. Attention to professional boundaries, patients, families, and caregivers. Nursing ethics and patients' legal rights demand nurses to keep professional boundaries when handling their clients to promote service integrity. In most cases, clinicians cross bounds when they get over-involved with their customers. Therefore, nurses need to understand how far they can engage with individuals in their care. No matter how the patient behaves, it is the nurse's legal and ethical responsibility to maintain a therapeutic relationship. Nurses should not engage in self-disclosure that has nothing to do with what the patients are going through. Further, there should be no secrets between the practitioner and the patient. For instance, they cannot call or text a patient or family members privately. When assisting patients in moving or comforting them, the medic should mind how and where they touch the clients. It should only be therapeutic and allowed touches by the nursing guidelines. Doctors should never have sexual interest, relationships, or behavior sexually toward their patients. The latter is morally, ethically, and legally wrong, which has left many practitioners facing the law of sexual misconduct. Staff should not make a patient believe that no other person can take care of them better. Workers should also not receive money or gifts from patients or their families. It is against nursing ethics. Maintaining boundaries is vital in avoiding moral, ethical, and legal violations.